This is a short information video on tennis elbow. So what is tennis elbow? Tennis elbow is, although it's a misnomer and a commonly used term, it's essentially used to describe any pain that happens on the outer side of the elbow, so along that side. In medical terms, it's also called as lateral epicondylitis. Again, it's a misnomer or a wrong name, as the condition is not an inflammatory condition, but it's more of a degenerative condition. The reason why tennis elbow happens is that the tendons that supply your finger's ability to extend, they get degenerate, their attachment around the top elbow along there, and cause pain. There can be also some tear in the tendons, which is part of the natural history. What are the symptoms of tennis elbow? So commonly the symptoms is localized pain around the outside of the elbow. Patients will have difficulty with gripping and holding things. You may or may not be a tennis player, but certainly if you are a racket sport person, then it may be worse. It can happen to anybody, there is no age that is barred. Patients often describe annoying type of pain and a deep-seated ache around the elbow. Interestingly, patients also find all sorts of doors and windows and the wall that you bang the arm against, making it more painful. There can be some pins and needles and tinglings in the hand, but it's not limited to one particular finger. Patients also find troublesome in writing using keyboard, lifting a cup of tea or a kettle. How do you diagnose tennis elbow? Tennis elbow is diagnosed based on good clinical history and examination. Generally, there is no tests that are required for diagnosing a tennis elbow. If, however, I feel that there could be something else, then a variety of tests may be conducted, from plain X-rays to MRI scans or CT scan to rule out other conditions. What are the treatment options with tennis elbow? In vast majority of the patients, tennis elbow resolves with non-operative treatment, and again also non-invasive. One of the most important aspects is physiotherapy, wherein they will do some exercises and eccentric loading. Please refer to my website for specific tennis elbow exercises. Along with this, I would advise to use a tennis elbow band, and this band is fairly specific that I like, and it provides, reduces the stress and the pressure onto the tendons, which reduces the pain and also allows for the tendon healing. The next level of treatment would involve what is called as a shockwave therapy, which is over 3 to 6 sittings, and it involves using a shockwave machine on that point, and again it allows the healing. Other important stuff that I found is to do some local massage onto that area, which improves the circulation and healing. Traditionally, steroid injection was used and is still used, but as it's degenerate, it's quite counterintuitive to use steroid injections for the tennis elbow. I have now reduced or almost given up using steroid injections for this, although patients do have some improvement, but a number of studies have shown that patient would have got there even without the steroid injection. Also, we use a technique which is called dry needling, wherein using a needle we make a few punctures around the bone, and this facilitates the healing. The newer treatment is use of PRP injection, which stands for platelet-rich plasma. In this, we take about 10 to 15 milliliters of patient's own blood and then spin it and remove the top of the platelet, which has got growth cells in it, growth factors in it, and then this is injected around the degenerate tendon. This is showing promising results, but it's not yet proven beyond doubt. Does that feel more painful?
Well, I can feel it down there.
Yeah.
Go towards the back.
Don't worry about the pain.
Easy, bro. Oh.
I use a PRP or platelet-rich plasma on a regular basis. In this patient's own blood, about 10 to 15 milliliters is spun for a few minutes to leave this plasma, which is drawn. The plasma has got high concentration of growth factors, which helps with the tendon healing, and this is then injected around the painful site with or without an ultrasound guidance. And this has shown promising results in the early stages. Reducing certain activities that bring on the pain is always helpful. The tennis elbow brace needs to be used for about 3 months or 4 months, and I always advise to use it for 7 days of the week. Often patients forget to use it on the weekend, thinking it's not required, but remember, even on weekends you may be doing activities that involve gripping and holding things.
Get off today. Just...
So if we put it through there. So if you best it, so if you put it in that position,
Yeah.
Yeah.
So you want these points on?
Yeah. How does that feel?
Yeah, I mean, I have been wearing it.
You've been wearing it, and is that where you've been putting it on?
Yeah, pretty
So
much.
I think
I've sort of been moving it around
Yeah.
sort of the different, wherever I sort of, I think around the instructions it said, and I watched a few videos, you try and put it just below where it is.
Yeah, so that's where the origin is, and the way I look at it, that you should be able to bend your elbow and straighten it, and this tightness you just need to adjust. So if it is too tight, then there's a nerve that runs along here, you'll get some tingling
Around there, okay.
in that area if it is too tight. So it just needs to be just under that, so that it's not. The final option is surgery. What does the tennis elbow surgery involve? So tennis elbow surgery can be undertaken either keyhole or open. I generally tend to use an open approach because I can see the degenerate tendon, and I can remove the degenerate tendon, clear out the area, and repair the tendon. Again, there is a video on my YouTube channel for tennis elbow surgery. At the end of the operation, put local anesthetic in to help with pain relief post-operatively. The wound is closed with dissolvable sutures which are tied over the skin, and butterfly sutures are applied on the top. Elbow is then supported with a big padded bandage, and an arm sling is applied to rest the elbow. Once you're back on the ward, you'll be seen by the therapist to arrange outpatient physiotherapy. I'm happy for you patients to start using the elbow as they feel comfortable immediately after the surgery, certainly to do light activities. The nurses will give you advice regarding the wound management. The big bandage can be taken out at 48 hours time, and the sticky plaster dressing changed as required. Patients may get into shower after 72 hours of the surgery, as the dressing is waterproof, and change it as needed. The sutures will need to be trimmed at 2 weeks, which can be done either at the GP practice or the hospital, or it can be done by the patient themselves. The ability to drive will depend on which side the surgery has been undertaken, as well as whether you have an automatic or a manual car. In principle, you can start to drive once the elbow feels comfortable, and you can be assured that you've got the control of the vehicle and be able to make an emergency stop if required. What are the risks of tennis elbow surgery? Most important and relevant risk is not getting better, and in my practice I see this is less than 5% chance of not improving. The other risk includes infection, bleeding, stiffness, making the elbow unstable, but this is rare. Damage to the nerves and vessels, again very rare, or any other general complication of anesthetic and surgery, but overall this is rare. This surgery that I do just take patients 6 to 8 weeks to get over, because it's a bony procedure, and the elbow can be sore for up to 2 to 3 months time. What about return to work following tennis elbow surgery? This will depend on the level of pain and the type of work a patient does. If you're office-based worker, then can go back at about 2 weeks. Any moderate workers would take about 6 to 8 weeks time, and heavy workers generally 3 to 4 months. But again, please discuss this with me at your outpatient consultation.